everyone. We are so excited to start off the month of May, which is traditionally dedicated to increasing skin cancer and melanoma detection awareness. We are going to talk all month long about different types of skin cancers, how we diagnose, what is the best way to prevent, protect, and of course treat. So I am thrilled Dr. Juneau, Michelle Juneau is here with me, and Dr. Michael Liu is here. We are starting the conversation about diagnosis, the frequency of treatments, and then we'll focus on what Dr. Liu does the best, Mohs surgery. So hey guys, I'm so glad we are here together, and
sure.
Dr. Juneau, start us off.
So, we treat a whole array of skin cancers in our practice. Focusing on melanoma, we talk to patients about how to do self-detection and also things that we look for as dermatologists. So something you all may have heard of are the ABCDEs of melanoma. What we are looking for with moles are asymmetry, border irregularity, color discrepancies or darkening, diameter. In general, if something's larger than the tip of a pencil eraser, then it's something that we call attention to, and then evolution. So if it's changing. So these are the things that you all need to be doing on yourselves, but also bringing to our attention and the things that we're looking for in the practice.
And what's the frequency that you typically, or any of us, ask for patients to come back for visits?
So with no personal or family history, once a year. Once the diagnosis of a skin cancer is made or there's a high risk, anywhere from 3 to 6 months.
Right. I think that it always surprises and amazes me how frequently patients forget about this annual skin check. And it's so simple. We do have a saying, we say, get in your birthday suit on your birthday, kind of a good way to remember when to come for these skin checks. But they're so valuable. There are areas you can't quite get to, areas that you can't quite see. So of course melanoma, but there are other types of skin cancer.
Yes, so the most common type of skin cancer is basal cell carcinoma, which is also the least aggressive type of skin cancer. And then squamous cell carcinoma would be the two most common non-melanoma skin cancers, typically associated with sun exposure and or genetic predisposition. So we do treat a lot of those, and we have great modalities for treating them in the practice. There's topical chemotherapeutic treatments, there's different types of surgical treatments, SRT treatments, radiation therapy, and Mohs surgery, which is a micrographic surgery that Dr. Liu is our board certified Mohs surgeon in our practice, can give us some more information.
Yes, well, take it away.
Yes, so basal cells and squamous cells are the most common type of skin cancers people get, and if you get them on the head and neck, there's a concern about getting rid of all the skin cancer while still saving as much healthy tissue as possible, because here on the face you don't really have a lot of real estate to spare. So Mohs is really the gold standard for the treatment of these basal cells and squamous cells, and we do it right here in this office, and it's a quite simple process, and we offer this here in dermatology consultings.
So there's a reason why we are in this particular room today, because I thought it would be really interesting. This is where you live in this part of the practice, but kind of, and if we can swing out so everybody can see, talk a little bit about the process of micrographic surgery.
Sure. So if you come in for Mohs, basically we mark the area, so mark the skin cancer on your head and neck or on your body, and then we numb you up, and then we cut out a circle of tissue, okay? And then we immediately process it to have it be seen under the microscope by myself, okay? That process takes about 45 minutes, and through the special processing, I'm able to look at 100% of the margin.
And I think you're sitting right next to this
Correct.
processing.
And
so
we have
I
an
think
amazing,
that's really, really cool, because I think, a lot of times patients don't realize how many different steps, and it is simple, but it's not. I mean, it takes an incredible skill to, of course, diagnose and identify and biopsy, but then send on for different treatments, and then, of course, surgically removing the first layer, having an incredible histotechnology tech that we have, histopath tech that we have on site. Kyle, I know you're behind the wall, and that preps the tissue, and then it takes an additional skill to sit down and look at the pathology and be able to identify. So what happens? You have a first stage, and then many times you have to go a little bit deeper.
Yes, so after the slide is processed, then I'm able to look at 100% of the margin. I look at all around the edges and all the depth. And so there's 100% margin control allows us to get the high cure rate of 98 to 99%, which is almost the highest, which is why it's the gold standard of treatment. So then I look at the microscope. If I don't see any more cancer cells all around the edges or all on the depth, then that means you're clear, and that means I go back into the room and we give you stitches, and then you go home, and you come back in about a week to get the stitches out. If I go back in and I see the microscope that there's a little bit more skin cancer, like say at the 2 o'clock area, then I can go back in and only take more tissue from the 2 o'clock area, thus saving the rest of the tissue on your face, so that we can save as much healthy tissue as possible. And then that
And
process
minimize scarring.
and minimize scarring. Perfect.
Right,
And then
exactly.